telehealth has so many benefits, from improved patient care and satisfaction to reduced healthcare costs. It might feel like access to telehealth should be made available to anyone who could benefit, and you might think that telehealth is fully accessible to everyone. However, this really isn't the case. In the United States, there are and have been significant barriers to providing and accessing telehealth services. Interestingly, COVID-19 has played a tremendous role in telehealth service expansion and access. And in fact, I would say that COVID-19 has actually had some really positive effects on access to telehealth services. And in this video, we're going to talk about what this looked like kind of pre-COVID, and then we'll talk about how COVID and the public health emergency actually increased access to telehealth. Prior to the COVID-19 pandemic, telehealth use was actually pretty rare. As of 2016, data from Medicare provided by the Centers for Medicare and Medicaid Services, they estimate that only about 0.3% of Medicare beneficiaries actually used telehealth services. As a reminder, Medicare is a federally funded program that provides health insurance coverage primarily to individuals who are over the age of 65, so that elderly population. And based on that data, what they're saying is that use of telehealth was pretty rare. It was really low. So not even 1% of Medicare beneficiaries, even though they had health insurance, were using telehealth services. And we'll talk about what some of those barriers are in the next couple of slides. Now, during COVID-19, what we saw is that telehealth use actually spiked quite a bit. So in the 1-year period from 2019 to 2020, what the data shows is that almost 40% of Medicare beneficiaries use telehealth services. So we went from about 0.3% back in 2016 all the way up to almost 40% between 2019 and 2020. So that's a massive spike, an increase in the use of telehealth services, which makes sense given the COVID-19 pandemic. So you might wonder, why was telehealth use so low before the COVID-19 pandemic? Why was use estimated at only 0.3% of Medicare beneficiaries back in 2016? Well, historically and traditionally, we've had some very serious limitations in accessing telehealth services because we've had some really high restrictions on the coverage of telehealth services. Now, these restrictions on coverage are pretty long in terms of the list, and we're not going to go through all of them, but I am going to highlight just a few. So when we're talking about coverage and what that looked like, we're primarily referring to what was covered under Medicare. Medicare, as I mentioned, is health insurance that's federally funded for individuals who are primarily over the age of 65, so that elderly population. In general, what Medicare does kind of sets the standard for what other insurers do. So if Medicare is going to start covering something, what we typically see is that private insurers then kind of start to follow suit, and they'll also start covering whatever that service is. So we're going to kind of focus on Medicare throughout this video. Prior to COVID-19, under Medicare coverage, telehealth coverage was really limited. It was limited to individuals who resided in rural areas who used telehealth at what we refer to as an originating site. And the definition of that originating site was a clinic or a doctor's office. So you had to be in an originating site in a rural area in order to have that telehealth covered. There were restrictions on the types of providers that could be paid to deliver telehealth services, so what we refer to as that distant site providers. And then there was a limited set of services that could be covered by telehealth, and that was pretty restricted. So these are some of the examples of the ways that telehealth coverage was really limited, which kind of makes sense in terms of why we saw such low utilization of telehealth services before COVID. Now, I would say one of the positives to come out of the COVID-19 pandemic is that there's been just some major reforms in terms of Medicare coverage for telehealth services. That coverage has been significantly expanded during the public health emergency. This slide provides a timeline of what some of that coverage, that expanded coverage looks like. You don't need to memorize all these specific legislation and policy actions here, but what I want to highlight and what I want you to really take from this slide is that there really has been significant changes. Congress has done a lot in terms of expanding that coverage. But the other big takeaway is while we've made a lot of progress during COVID, a lot of these expanded coverage policies are temporary. And so we don't know when those will end. At some point, they probably will end unless a more permanent solution is reached. So we briefly highlighted some of those coverage expansion policies that were implemented as a result of COVID-19. I want to briefly go over what that expanded coverage looks like. In terms of permanent expansion, there was the permanent expansion of the diagnosis, evaluation, or treatment of mental health disorders covered under Medicare. So that's a pretty big one, given that a lot of people have experienced very significant and serious mental health challenges during the pandemic. As I mentioned, some of the changes in coverage under Medicare are temporary, and they are not going to last forever unless there is some more permanent solution that is identified and that coverage is expanded on a permanent basis. This slide shows just a few of the ways that that expansion happened in terms of that temporary expansion. And so I do want to highlight some of these. So the first one is that Medicare will pay for telehealth provided at home. This is a really big one. Before COVID, Medicare coverage was limited to services delivered to patients located at hospitals and other provider facilities, so not at the patient's home. Remember, we talked about what we call the originating site. So prior to COVID, the originating site had to deliver those telehealth services, and that originating site was defined as a hospital, some sort of other provider facility. After the public health emergency, a patient's home was now considered to be another form of an originating site. And so that originating site definition was expanded to include a person's home, therefore making Medicare able and eligible to pay for telehealth provided at home. So that's a really, really big one. Another way that telehealth coverage was expanded under Medicare is that the public health emergency expanded the list of telehealth practitioners. And so this is another big one as well. Prior to COVID, only physicians, nurse practitioners, physician assistants, and other specified providers could deliver Medicare-covered telehealth services. But under some of the new law and legislation that got passed during COVID, the list of telehealth practitioners continued to expand and now includes individuals like occupational therapists, physical therapists, speech language pathologists, and audiologists, temporarily under this public health emergency. So we saw this big expansion in terms of the practitioners who were eligible to get reimbursed and deliver telehealth services. Another way in which telehealth coverage was expanded during COVID-19 and the public health emergency is this payment for audio-only telehealth. Audio-only delivery of healthcare services has historically very rarely been reimbursed and paid for. However, due to COVID-19 and the public health emergency and the need to practice social distancing, some patients lacked access due to inadequate broadband to support audio-visual communication. So if you are using something like Zoom and you're on a computer and you're using some sort of visual communication like Zoom, you're going to need pretty good internet access. And if you have inadequate broadband internet, you're not going to be able to get a smooth flowing video streaming going with your healthcare provider. And so what we saw during COVID and this public health emergency was this allowance for audio only modality to deliver some services covered by Medicare. Now, as I mentioned, a lot of this coverage expansion is temporary. And once this public health emergency is over and a lot of these policies and things that have been passed, when those expire, we're going to see this lack of coverage for all of these things that people have gotten used to. So far, the House of Representatives passed H.R. 4040, Advancing Telehealth Beyond COVID-19 Act of 2021, which is set to extend Medicare coverage of telehealth services until December 31st of 2024. So that would give us some additional time. This bill is still in progress and hasn't been fully passed yet, but it's something to keep an eye on.